Welcome to the CMS Lecture for Leadership and Management. My name is Kim McAllister, and I'll be discussing this with you today. CMS stands for the Centers of Medicaid and Medicare Services. CMS was established in 1965 by an amendment to the Social Security Act of 1935. Title 18 covers Medicare and Title 19 covers Medicaid. One link on the slide will take you to President Johnson's speech at the signing, and the other one will take you to the Social Security Act of 1935. This gives you the actual law. If you look at the President Johnson's signing, the speech is really great because it gives you some history into our healthcare system and helps you understand some of what things are the way they are now. So Medicare provides care for people over 65 and people with certain disabilities, such as the end-stage renal disease program. There are also other conditions that are covered. There's a process of paperwork and of examinations in order to be declared disabled. Medicare is 100% funded by the federal government. Medicaid provides for the impoverished who meet certain poverty thresholds. You may have heard of Medicaid CHIP. This is Medicaid insurance for children. In Texas, you'll hear references to Medicaid Star Plus. This is a Medicaid managed care program for persons with qualifying conditions. Medicaid is funded through the state and federal governments, and benefits will vary by state. If you have a patient who tells you that they're going to move and you know they're on Medicaid, have them contact the state they're moving to ensure that their Medicaid benefits won't change. Their benefits do change from state to state, and patients need to know in advance what that's going to mean to them. Both Medicaid and Medicare have managed care options. Those options provide lower copays, but have greater restrictions on where patients can go, which providers they can see, what hospitals or what other agencies that they can go to for care. In addition, they provide value adds, and these are additional services not covered under Medicaid or Medicare, but they're included at no charge to the participants. This is an incentive to have them join that particular Medicaid or Medicare Advantage plan. We're going to go into greater detail about Medicaid and Medicare in community health. Some patients are on both Medicaid and Medicare, and then they require Medicare-Medicaid coordination. If a patient comes in who has both, a case manager is very helpful in helping patients understand what's being covered by which insurance, how to get prescriptions, DME, that's durable medical equipment, and other medical supplies or other supplies after discharge. Medicare and Medicaid coordination can be kind of complicated, so a case manager is a good idea. Medicare, and we also have Railroad Medicare. That's for people who worked for the Federal Railroad program. Their Medicaid card will designate them as Railroad Medicare. Just know that that may happen and don't let that through you. There are links to all of these sites and for some other sites at the very end of this presentation. Medicare is the nation's largest funder of health care. Over 40 million people are participating in it. Because of this, the federal government is the leading regulator of health insurance. Medicare reimbursement rates and other regulations are used by other insurance companies as well. You may have heard the saying, as Medicare goes, so goes the insurance, or so goes healthcare. Providers and agencies such as hospitals, clinics, rehab, home health, and so on must follow conditions of participation to receive reimbursement from these agencies. Conditions of participation is a set of rules, regulations, and guidelines that must be followed by agencies and providers. Organizations who wish to obtain reimbursement for Medicare and Medicaid must follow the regulations. They go through an exhaustive and extensive process of certification prior to serving these clients. CMS has a regulating arm, the Quality Improvement Organization, which was formerly called Peer Review, and it works with a state agency to monitor and improve Medicare and Medicaid recipients' care. Reimbursement rates are dependent on the data reported. As a nurse manager, monitoring quality indicators has a significant impact on funding for your agency. Help employees understand so that they are willing to assist in quality improvement measures. Agencies that report poor quality management indicators or poor quality indicators are subject to lower reimbursement rates, fines, and even removal from participation. I was hired as a director of nurses for an agency, a home health agency that had lost its Medicare certification. I was hired to find out what went wrong and figure out how to fix it. Just one nurse, had violated the conditions of participation, and that caused the agency to lose their certification. So 40 employees suffered. One nurse caused 40 employees to suffer. I worked closely with the Medicare representative and was able to regain our certification 2 months later. It was not an easy process. The owner stated he learned to provide greater oversight, and we worked together to institute additional quality control measures to prevent the recurrence. This was a costly problem, and it has caused other agencies to close. As a manager, it's vital to understand the conditions of participation for your agency. In addition to state regulators, which can certify agencies, national regulators have deeming authority, the authority granted by CMS to certify organizations. The most familiar deeming agency is Joint Commission. Deeming authorities help agencies become certified without the requirement of seeking certification through the state as well as the federal government. Page 178 in your text provides a list of all deeming authority agencies. It's in Table 7-3. So how can you participate in the process? As a case manager, ensure your patients are receiving care, follow up, and receive the benefits that they need. Track potential problems and coordinate care to prevent violations of quality measures. As a nurse manager, know your quality indicators and ensure they're met. Participate in quality assurance. Review charts for accuracy. If nurses are not documenting supplies and procedures and treatments, then reimbursement can be affected. Check the patient ICD codes to ensure patients have been correctly coded. Upcoding, coding for a more severe condition than the patient has or a more extensive treatment than what was received, is fraud and can result in fines and imprisonment. Also ensure coding is set for the appropriate condition and status. For example, a patient admitted for a routine surgery may develop complications. Make sure that the reimbursement codes and the ICD codes have been updated to reflect the increase in need. Utilization review examines cases when patients require more services or products or treatment than the standard reimbursement allows. Nurses examine records to determine if requests for additional care, supplies, or equipment beyond the allowable are truly needed. This is where documentation is really important because they will look at that. Nurses can also work for Medicare or Medicaid. I worked as a service coordination manager for Medicaid in Texas. Insurance positions provide lucrative salaries and often allow employees to work from home, which is really nice. Some patient care tips. If your patient is 64, remind them to apply for Medicare at least 3 months before their 65th birthday. The insurance will drop them or convert them to a Medicare or a Medicaid supplemental policy. Many patients are not aware of this. Patients apply for Medicare and Medicaid through the Social Security Administration. There are forms online, or they can go to the Social Security office in person. Advise them to check the website or to call and learn what documentation they need to bring with them. If your patient is a child who's on Medicaid, they need to apply for adult Medicaid at least 5 months before their 21st birthday. Some Medicaid providers who care for children will not care for them after they reach 21 due to changes in reimbursement and participation. They need to check with their providers, therapy, or other agencies that are involved in their care to determine if new providers will be needed. This is a list of helpful links for Medicare and Medicaid. This will send you directly to CMS. This one sends you to Texas forms for Medicaid. This goes to Medicaid and to CHIP. This goes to Medicare Part B. Medicare Part A is covered by the government. There's no charge for that. Medicare Part B is something patients can choose to do, and you have to pay. And the payment depends on a lot of different factors, but that's something they have to pay for. This gives you a link to the Medicaid information manual and also a link to Medicaid Star Plus. There also is medication, prescription drug plans, and so on. We're not going to get into that right now. We will go into all of this in community health.